Welcome everyone. This is the Medical Futurist live Q&A session. Hopefully you can hear me well. You can see me even better. Please confirm in the chat. I would really appreciate that. My name is Meskó. I'm your medical futurist. And as usual, we are here for live Q&A for 60 minutes. I will do my absolute best for you to answer as many questions as profoundly as possible. And if you wonder why I will be able to answer those questions, it's because I've been doing this for more than a decade now, for 10, 12 hours a day. My background is I'm a medical doctor with a PhD in genomics, but now I'm a professional short-term futurist, and I'm trying to remain practical here. So the plan is that I will try to give you insightful answers. I will do my absolute best. If it's not possible, then our editor-in-chief, Judith Kusko, is also on the channel, and she will be able to send you a few links, some of our articles, analysis that we publish regularly on medicalfuturist.com. It's great to see so many familiar faces: Adam Schmidt, Mihaela, Jose Quintini. It's great to see you all. Thank you for being in this live Q&A as well. I see that many questions have been coming in. We also received more than 50 quite insightful long questions through the Eventbrite website. So I have plenty of things to do here in the next 57 or 8 minutes or so. Before diving into the topic we have for you today, let me share with you a little infographic we just put together. And actually, we released it a few minutes ago, literally, before going live on YouTube. I wanted to put two things on one infographic. One is about the number of daily new cases of COVID-19 every day in Israel. And the second was the number of people who have received at least one shot of the COVID vaccine. And that's what you can see here. On the yellow that represents daily new cases since December, and the red one represents the percentage of population having received at least one shot. It means it's now about more than 60% of the population in Israel have received at least one shot. Can you see this scissor, this opening gap? That's what every nation is longing for. To see the daily new cases, the number rising down, decreasing and flying down, but at the same time see that we have more and more people receiving the first shot. This is the gap that we are hoping to see in as many countries as possible. And that's why we all have to get vaccinated. I know I always get back to this, but I'm really fed up with talking into a lens of a camera for 11, 12 hours a day, every single day. And I would love to travel again. I would love to meet you in person again. And the only reason why we do these live Q&A sessions is because I cannot meet you live. I cannot see you in person somewhere around the world in a conference room, lecture hall, or different buildings. So please get vaccinated so we can get back to a new kind of normal. That's the plan here. So while leaving that behind, let's dive into the questions you sent to me already in the first seconds of the live session. John, hello doctor. One thing that I wanted to ask is, what is the skill that current medical student needs to learn to keep up and stay relevant with future technological advancements in medicine? What an excellent question to start the session with, John. I think if I had to choose one, then the most important thing would be the skill of foresight, being able to extrapolate from today's trends into the near future. I'm not saying that medical students have to become futurists themselves, but I do say that medical students have to have the skill to be able to anticipate the future. They anticipate when practicing medicine. If the patient comes up with this diagnosis and I give them this treatment, usually this or that happens. That's even anticipation. But if they can translate that anticipation skill into other parts of their lives, such as how their practices will evolve, how the needs of patients will evolve, then they would be in a pretty good position to meet any kind of new demands. Ohena Bar, what do these trends mean for Africa and other developing countries? We will get back to that when we start discussing today's topic, which is the top 20 digital health trends. And I'm so happy and relieved that I can share this with you. Of course, the reason why we do the live Q&A now about this topic is that a few days ago we released our newest ebook. Here it is, the top 20 digital health trends for the near future. Not the next 10 or 20 years, but we try to stay practical here. Plus, it's not the kind of list you usually see in those executive summaries like here is VR and AR, AI and telemedicine and all these. No, we try to be as precise as possible. I'm very proud of that because every trend we included in this executive summary, in this ebook, is a precise trend. We try to come up with one technology, but then summarize what's really important about that technology from the digital healthcare perspective. And if you go to, I'm sure that Judith Kusko, our editor-in-chief, who is on the chat with you today as usual, she can share the link to the article we had about the ebook. You can even dive into the ebook for free, the first 20 pages or so for free, so you can get a sense of what kind of ebook we try to put together here, where there's an anatomy of a trend. We describe a very precise trend. We describe it with so many examples and real life stories, and then we summarize it and provide further reading. So I hope that you can check it out and you will enjoy reading that. We are, again, very proud of that ebook. And that's why we talk about the top digital health trends of the near future. Today, Akhil Draksharapu. As usual, if I pronounce your name in the wrong way, please forgive me. I have an awful name to pronounce in Hungarian. Please bear with me. What do you think is lacking in the healthcare space? And what can change the US healthcare and bring costs down? Akhil, it's a question like, how can we go to Mars with spaceships? How can we change healthcare with better education of medical professionals, with better incentives for practicing professionals, for better regulation for patients and companies, and in general, a better understanding of how technologies can impact healthcare? Of course, that's not a useful answer, but the more precise you can be with the question, I believe the more insightful answer I can provide you with. Dr. Yogesh Dukare, let me share this question with you all. Please keep them coming. To what extent teleconsultation would replace in clinic patient visit, and would data privacy and other regulations change in favor of teleconsultation? Absolutely, because telemedicine is the new norm. It should have been the new norm already before the pandemic, but the pandemic made it clear that remote care is the new norm. You don't want to get exposed to infections. Plus, let's be honest here, in so many cases, it has been a luxury to be able to meet a healthcare professional in person with even minor health issues to handle. So telemedicine should be okay. And I just took part in 3 events today, but in one of the events, in a Belgian event, I was told by a professor in Belgium that the previous health minister of the country had been talking about introducing telemedicine on a large scale in the whole country. For 5 years, nothing happened. And then the pandemic came, and in 2 weeks, they had regulations, incentives, everything in place. You know what Winston Churchill said, let's not waste a good crisis. That's what we can use the pandemic for. Therefore, yes, teleconsultation will remain with us, I think, forever. That's the new norm. And as we can see, based on the examples already out there, it is absolutely possible to provide the right regulations, incentives, policies, and even medical guidelines for doing that in the right way. The American Medical Association already provides trainings about doing teleconsultation visits, even for mental health professionals, which is quite a tricky thing to do. All right. Wow, many questions coming in. I'm trying to keep up with all you. John, one more question. Even if AI can't completely replace doctors, will it reduce the demand for general practitioners significantly? And what can I do about if I can't take specialty program? AI won't replace physicians. We talked about it in the last live Q&A session. You know it well. It will replace many repetitive tasks medical professionals have today. I don't see how the role of GPs would change that dramatically. I'm sure that lifestyle medicine will dive into the work general practitioners do, and AI will play a certain role in that, if not the biggest role out of all the medical specialties. So if you want to be a general practitioner, of course, there is a huge future for that. Maybe one of the biggest ones. Hans, greetings from Panama. Thanks, of course. Thank you for being here. It's great to see you here. Alejandro Ceballos, Paraguay. Wow. welcome to the show. Mihaela Lekic, great to see you again. What are the trends in robotic surgery? It's a great question. The reason why being is that there was just a great article on Wired, as far as I remember. Maybe it was the Scientific American. We just shared it like 3 days ago. If you go to my LinkedIn page, you will find a really great summary of all the things going on in robotic surgery. I haven't seen any trends that would impact high-level understanding of digital health, but there are some minor trends about the precise ways how robotic surgery is being improved. Only 3% of robotic procedure or surgical procedures today are being done by using robots. It's not a big number, but in that article they really dive into the details about what they have been doing in that sense. Pablo Marone, daily hot issue, best practices for keeping our medical ecosystem updated with so many new technologies, possibilities, and business models. It's an amazing point. And I guess the question is, how can we do that? And please forgive me for saying that, but that's why we exist at the Medical Futurist. For those who don't know us or what we do, at the Medical Futurist, we are a small team of 12 people, and we try to provide the context around digital health technologies on every social media channel, in YouTube videos, through keynotes and executive summaries and books and ebooks and all the channels you can imagine. So if you see an announcement coming from a company or a new study coming out about digital health technology, we are right there to read it for you and then to summarize what really matters from that summary, from that study, what we have to really conclude from that company announcement. We try to work against hype and we try to work against rejection just because someone fears an advancement of a technology. So that's why we exist. Please go to medicalfuturist.com and check out what kind of things we publish and share every day. Omkar Pandey, it's a very beautiful question indeed. Let me share it with all of you. How can regulatory framework keep up with the rapidly changing healthcare landscape? People work in those regulatory agencies and people have to keep up with these changes. My favorite example is how the FDA, the US Food and Drug Administration, has been doing that. They have been organizing 3D printing workshops. They have been trying to regulate artificial intelligence-based medical technologies. And even if they don't do a perfect job, they do a pretty good job. And it's an example that other agencies should follow. So that's how, by people working in those agencies, keeping up with all these changes, organizing workshops with industry partners and companies that have been working with the technology they want to regulate at that agency. I think it's possible because there is at least one example that has been doing it in action. Sandeep Patel, it's an interesting question to ask. I'm not sure if I can answer it. What will be the future of exam pattern in surgical residency? Will VR, AR accepted largely by medical institutions? For the latter part of your question, there are some medical schools, mostly in the US, where VR devices, in some of them mixed reality HoloLens devices, have been used to support teaching, the process of teaching medical students. But for the first one, I'm not sure what you mean by that. I've heard about attempts at changing the time when medical students should take the exams by using an AI-based algorithm, to making sure medical students, study through the entire year, of course not through the exam periods, and they have a smartphone app and they can do quizzes. And when the algorithm concludes that this is the best time for you to go to take your exam in this subject, then they can do it even when it's outside the normal exam period. So if the question was referring to this topic, then this is my answer to that. Ooh, Alan Wafi, what an amazing question to ask. Let me dive into it right away. What skills do hospital leaders need in healthcare to implement digital transformation? I love the question. Let me share with you something we just published. One thing about this is that I hate the expression digital transformation. We just wrote about why at least pharma companies should stop using this term because it means nothing. But I understand what you're implying here. And I assume that the biggest thing that these healthcare leaders need to keep in mind include patient design. So involving patients on the highest level of decision making of that healthcare institution. The second thing is foresight, like in the case of medical students. And maybe the third thing would be more about embracing the cultural nature of the digital health revolution. So if a healthcare leader thinks that there's a technological revolution going on, then they might get into a position where they will get it wrong because there's a cultural transformation going on, not technological one. If you give a VR device to a patient expecting that they could use the device and, fly over Iceland to feel better while staying at the hospital, nothing will happen. But when you give them a VR device and their physicians can act like a coach during the process, discussing the expectation, technical difficulties, all the questions they might have. So the technology is just there to improve their relationship. Then it works, and pain is significantly reduced for those patients based on studies. So that's why the leaders have to embrace the cultural transformation that we call digital health. All right. Akil, these Q&As are not held every week because it would kill me forever. I'm on all my social media channels. If you go to the Medical Futurist, then you go to Facebook, LinkedIn, Twitter, YouTube, or Patreon, or Instagram. You can ask as many questions as you want, and I always try to be there to answer them. But we have these sessions here like twice a month approximately to have a vibrant discussion with you. That's why we have these Q&As not every week, but almost every second week. Ooh, it seems like that I'm lagging behind your questions. Such YouTube live Q&As stop once the pandemic is done and you start going for keynotes. I would love to go back and travel, but I cannot imagine my life without these keynotes, without these Q&As, without these chances to have these discussions with you, without these 1 hour long sessions being challenged and poked by many of you by amazing questions. So I'm 100% sure that even if I can go back to travel right now, I will keep on having these live Q&A sessions because I love them. Nitin Thakur, the question is great, but I don't think it's my area of expertise. How medical technology and life science industry will transform the way of sales operations in the next couple of years, considering COVID pandemic is hitting us with multiple waves. I have no idea. What I've seen without having any expertise in the field is that for those companies that basically did sales in live events and big exhibitions, they cannot do the same through these virtual events. Plus, I'm a keynote speaker primarily, and I take part in about 15, 20 events a month. Of course, not as many in person, even back then, but big events do not work virtually. They just don't work. For events like HIMSS and CES, you need to go there in person. But for smaller events and smaller internal meetings, it's an incredible waste of time, energy, and it's going against climate change to hold those meetings and to fly in people from everywhere. No, let's keep on holding those smaller meetings online, but everything else will take place in person. Therefore, those sales companies can go back doing what they had been doing even before the pandemic, hopefully quite soon. Pedro Camargo, greetings from St. Petersburg, Russia. Hi, welcome. Adam Schmidt, which disease, let me share the question with you all so you can all see what I'm trying to answer here. What disease treatment do you think will turn upside down next after diabetes? Example in diabetes hybrid insulin pump, which revolutionized diabetes care. First of all, it would be great to see diabetes being turned upside down with good technologies being implemented into the disease management of those patients. Maybe autoimmune conditions where biological therapies play a role. Those biological therapies are quite expensive, and I've seen the last 3-4 weeks or so some genetic kits coming out, becoming accessible, that will be able to essentially predict if a patient with such an autoimmune condition would react to those treatments or not. For them, it would be pretty much turning the treatment upside down, making sure that even the first line of biological treatment would be efficient because they know it based on the patient's molecular genetic background. I would be pretty excited by that. Daniel Berkler, do you think VR will have an impact on forensic pathology in practice? It's a nice question to ask. Let me think about that. Maybe in the educational part, maybe while training forensic pathologists, VR might have a place in the process, but in the practice of doing that, I don't see its place. I don't see why virtual words should be created to augment what they have been doing through that technology. But again, in education, maybe preparing students for cases they will have to come across in practice, for that purpose, VR might have a place in that. Evelyn Silvashi, thank you for the question. I'm afraid I won't be able to give you a proper answer. Did you find any solution for how data could be treated anonymously? If it works like cryptocurrencies, like you can't find IP addresses there either, couldn't you see this StarCraft feature here? Sure. I think there are blockchain might be one technology that might be able to do that, making sure that patients' data remain intact and their privacy is not breached. That's possible, but you see many companies coming out and rising, claiming that they use blockchain, but you don't see many companies using blockchain being implemented into the actual delivery of care every day. But maybe blockchain could be one solution for that, very similar to how cryptocurrencies work actually. All right. Dr. Yogesh Dukara, doctors have been found resisting artificial intelligence for diagnostic and decision support, fearing that doctors would become redundant because of technology. How to counter this mindset challenge? By pure education. So we know that AI won't replace physicians, but those physicians who use AI will replace those that don't. It's about giving them the right guidelines, protocols, and the general understanding of what they can keep in mind while working with AI. The American Medical Association published an explainable AI guideline, which is incredibly useful. And also at the Medical Futurist Institute, we published a study about all the things medical professionals need to know about AI. If you don't mind me sharing that with you, I think by sharing this open access free paper with as many medical professionals as you can gradually help them prepare for whatever is coming next. They will learn the levels, the basic definition, the methods of AI, the benefits and the dangers, the risks and the advantages, everything for free. So I will share that link now with you in the chat section so you can check this open access paper out if you want. All right. Should medical software be subject to similar levels of quality control as medical devices? Absolutely. That's what the FDA has been working on for so many years. It's called software as a medical device, and they have been publishing protocols and guidelines about that. And the issue here is not just whether software should be treated equally as technologies, as hardware. It should be the case, but really about how to do that with algorithms. You know, there's an issue about regulating logged versus adaptive algorithms. Logged algorithms do not change. You write the code and then you can use it in action. And they are being regulated right now by the FDA. We published a study about that, and more than 60 of those technologies are in place now. But the issue is how to regulate adaptive algorithms that become better with every decision those make. And the idea that the FDA has now is that they wouldn't be able to regulate every version, every iteration of the algorithm. It's physically impossible. So they should regulate the company instead, and also regulate the framework the company uses to make the algorithms adaptive. That could be the case. Rusha Patel, thanks for amazing content. Of course, thank you for that. What do you think about bioelectronics, electronic pills? Can you make a video on this feature? You know what? How How is it? I don't believe that we don't have a video about it already. I'm sure we've covered that. But if not, you are right. We should have a video about it. But our editor-in-chief, Judith Kusko, can share our article with you about digital pills. In summary, I think that digital pills can be very useful for very specific purposes. Using them for patients where compliance is an issue, like in certain mental health conditions, or with elderly patients where compliance is an issue by its nature. But in every other case, you won't see every pill and medication becoming digital just because it looks great. That's a summary of the article we published. John Sharp, it's great to see you here. Welcome. I think it's the first time I see you leaving a comment on the channel. So welcome. I hope to see you again in person somewhere soon. So you said that you have used the term the home as the center of care rather than virtual care or remote monitoring. Can you explain why? I don't think that there's a physical difference. The reason why I always say that digital health makes patients the point of care, because that's the high level context around digital health technologies. When people ask me how to summarize what digital health is about, I would never say that it's about bringing more technologies to the doctor-patient visit or improve doctor's job. Digital health is about making patients the point of care. Every digital health technology is pointing into that direction. But at the same time, what's happening physically is remote care or virtual care. I don't like to use the term virtual care because care is not virtual. It's real. It's just taking place through a digital communication channel. Remote monitoring, remote care sounds better to me, but that's why I always say that the home, not even the home should be the point of care. I always say that patients should be the point of care wherever they are. If it's the home, if it's on the street, that should be the place where they receive diagnosis, treatment, and monitoring. Mihaela, it's an excellent question, and I feel your pain. I struggle with the same thing, keeping up with the scientific literature and seeing the bigger picture. The problem is just using Semantic Scholar, Google Scholar, and I use Google Alerts. So when there is something big coming out in my favorite scientific fields of interest, I receive notifications by email. I can check out those studies, but that's just about giving me even more studies I can read. The problem is about summarizing those studies, and that's what some of us are doing. But I try to do that through the Medical Futurist channels. But if I can point out to two fields, both will be in AI by chance. One is Eric Topol has an amazing newsletter, a free newsletter called Dr. Penguin. This is just excellent. Every week they send out the 5, 6, 7 most important studies of the week, summarizing the major findings. And also there is one called on deeplearning.ai. You see a free newsletter, and every week they summarize everything. So that's how that you try to find those scientists, think tanks, research groups that summarize those findings for you. I'm afraid that's the only way. Manar Vasu, I would love to help. I'm studying Master in Digital Service Innovation in Sweden and planning to work in thesis in innovation in health sector. Do you have any advice about what subjects that we can focus on? I guess everything around digital health. It's such a broad question to ask. If there is something specific you're interested in, I'm happy to think about if I have some resources to suggest. But in general, I would suggest looking at like the top 20 trends that we just published. Those summarize the most important innovations of the last few years. Marina, greetings from Minsk, Belarus. Hi, welcome to the session. Rusha Patel, do you foresee let me share the question with you so you can all see that. Thank you so much for being here with me, for asking those many amazing questions. Next one, do you foresee a future where doctors will be fully replaced by tech, at least the diagnostic part? If so, how far are we from it? I don't, simply don't. The reason why is being that any element in the process of practicing medicine, if it's purely data-based, that can be replaced by algorithms, automation, and so on. But the diagnostic part is never fully data-based. It's also interaction-based. It matters what experience you have, what knowledge you have, how the patient walks in, what's the first symptom they mention. All these things matter. I just don't see, not even a decade or 2 decades from now, how this would lead to replacing physicians in that part. At the same time, I have zero doubts that no physician will be able to practice medicine in 5 to 10 years without the active support coming from AI-based medical decision tools. Pablo, what are the next steps in terms of doctor-patient collaborative medicine? I'm not sure what you mean by that, but let me assume what you mean by that, and let me describe to you my relationship with my primary care physician. We have a partnership. She counts on me. She counts on my proactivity as an empowered patient. I count on her knowledge and expertise in her medical specialty. We together count on the technologies I use in my health management. But if there is something she cannot answer to me, she tells me, I don't know, but let's sit next to me and let's find out together. I think that's the approach that we are looking forward to seeing more in collaborative medicine. Adam Schmidt, what a wonderful question to ask. Do you think that patients will ask for second opinions from doctors from countries with different healthcare system thanks to the rise of telehealth solutions? Absolutely. I think digital health makes healthcare globalized. Whether it's ideal or not, whether it's great or not, whether it's safe or not, it gives us, these technologies give us a chance to ask for second opinion from doctors we have never seen before. I'm not saying it's ideal, but I do say that patients should have the right to decide who they are working with. And when it becomes possible, and I think it's possible by now already, to reach out to startups and companies in different countries and provide and receive care that would be targeted to your own needs, that would be customized to your molecular background without meeting anyone in your healthcare system, then asking for second opinion is no feat. Therefore, absolutely, that's the answer. Oh, Michael, hey, Madi. Great content, thank you. What would be the best conferences about future medicine in 2021? Are there any? I haven't seen any. Maybe there are online events, of course, but those get organized so fast that I just don't see any events in advance in months. I will take part in many events. I will be a keynote speaker. Like I have like 20 lined up for the next 2-3 months, but I can't give you one conference name at all, because again, the really good ones that have been organized, that were organized before the pandemic, have not been organized yet. I guess they are still waiting out to see where the vaccinations are going. Omkar, what breakthroughs can be expected from big data of healthcare companies? It's a good question to ask. I guess I can be a bit visionary in the answer here. I assume it would be great to see medical decision support tools that are also validated in medical studies. I would love to see breakthroughs about not retrospective but prospective studies. So, AI companies deploying algorithms that can predict the clinical outcomes of patient routes in action, and it would be revalidated later on. I guess that would be the biggest breakthrough at all. Yeah, because we haven't seen, maybe only a handful of studies have been about prospective AI studies, not retrospective ones. Pablo Marone, do you foresee an Uber-ized medicine? Platform, app, doctors, ratings, no borders, no associations, price competition. I think we discussed that in one of the articles before. The concept is something that could be viable, but I haven't seen good examples for that. I know what you mean by Uber-ized, but the only sort of Uber-ized example I've seen was in transportation. There's a company called Circle, and they make sure that people don't miss their medical appointments, because millions of appointments are missed every year in the US, and it costs a lot to the healthcare system. And they work like an Uber-based service, but only for medical appointments. Maybe that's an Uberization of healthcare already. Alan Wafi, welcome back to the live session. Let me share the question with you all. What do you think about EU legislation about privacy, GDPR? We all love it so much. And software and AI, will it have a negative impact? I think GDPR is great in its primary goal. It's awful in implementation. It just ties our hands in so many ways. And when it comes to sharing patients' data, even safely in between silos of healthcare institutions, it becomes almost impossible. And without data, there is no AI revolution. AI is only as good as the data we feed it with. So that's not so good news. But in the sense of AI, I think the EU is doing a very bad job. They are lagging behind. They should, if they just follow the example of the FDA and the US in general, that should be enough. But they are still lagging behind. And I haven't seen, it's 2021. And the last report I read from the EU about AI was a report in February, as far as I remember, which was more about an idea that very soon we should regulate AI. That's just not enough. There are, patients using algorithms already. There are more than 70 medical technologies, purely AI-based technologies being approved by the FDA already. It's just getting too late. And I'm afraid that patients will reach out to those technologies directly, and that's just not safe and not ideal for any of us. Alejandro Ceballos in Paraguay. Oh, what a nice question. So in Paraguay, patients are not the owners of the electronic medical records. When you change health insurance, you have to start all over. Is out there a country where EMR are in patient hands? I think there are many countries where at least you have a clear access to your medical records. Even in Hungary, I have access to my medical records digitally. In the US, there are many, not all, but many healthcare insurance companies and providers that allow patients to have their records accessed. And it sounds wrong to say allowed, because the data belongs to patients. Those medical records belong to patients. They have paid for that through their insurance and taxes. So I think, I'm afraid in many countries, patients can access their medical records. I'm so sorry that you cannot do that. I assume you have to do it yourself. So creating simultaneously a personal health ecosystem, like on your computer, so you can bring it with you when you change health insurance, but it still sounds awful. Of course, Hamed, could you please tell us about ethical issues of using AI in healthcare and ways to solve them? We had a whole session dedicated to that before, and it's such a huge topic to tackle and discover. Just some issues include privacy. There is no AI revolution without breaching your privacy. Others include the black box paradox, that we can't really understand how the AI makes decisions, and when it comes to medical decisions, it's a threat to all of us, just to name a few. But we have an article on medicalfutures.com. Judith Kusko can share with you in a second. And can AI pays the treatments in places like Africa? Well, I think if you look at the case of Rwanda, which is quite a great example, and we have an article about that too, then you will see how AI is being implemented in that country, because Rwanda had to take a leap into digital health instead of building a traditional healthcare system. Hi, Mohammed Makavi. Nice to meet you again today. How do you see the future of digital sedation, and is it going to be used effectively? I don't know what you mean by that. If you could elaborate on that, that would be really helpful. All right. And for a second, I stop now because you have sent a lot of questions through the Eventbrite website as well. Let me share some of those with you. Just like one example here. Balakrishna had this question here. What are the immediate tech trends within a decade? Well, that's exactly why we published the ebook of the 20 precise digital health trends, but I would say the empowered patient movement is obviously one. The rise of telemedicine because of the pandemic, the rise of at-home lab tests, the rise of home sensors, and maybe the use of AI for very specific purposes. I guess mostly in radiology, just to name 5. Oh, yes, that's quite an exciting topic. What are the most innovative and promising mental health developments? We will come up with an article next week on medicalfuturist.com about music therapy and how music might help with the mental health pandemic that's going on after the current pandemic. But obviously, I should mention meditation apps like Calm and Headspace that have been thriving during the pandemic. And there are even EEG sensors like Muse that can help you meditate properly. I just think that with the mental health issues we face during the pandemic, what really helps is pure meditation and not the use of technologies. But some of these might be helpful to some people. And jumping back to your live questions, let's suppose the pandemic like COVID occurs again in 10, 15 years. There's a chance for that. Will the future medtech make any difference in our approach to fight the pandemic in a better way? Wow, of course. Just imagine how the first announcement came out from an AI-based company, Blue Dot, about the outbreak in Wuhan. So the next pandemic will be hopefully announced in time by an AI-based service. Just look at how telemedicine has become the new norm. So when we have to switch completely to telemedicine, most of us will have quite good experience with that. At-home lab tests will thrive because of this pandemic. So the next time we can have a better chance to provide laboratory services, even at the homes of patients. AI will be implemented by then to sort out logistics and the supply chain for hospitals and healthcare governments, like what Germany did during the first wave last April. But maybe more importantly, the vaccine research will be advanced so much by then that we will be able to deliver and deploy vaccines as soon as possible, not even in 10 or 11 months, but 1, 2, 3 months after an outbreak. That would give hope, right? That we can tackle the next pandemic too. Mihaela, do you think the most breakthroughs in healthcare will come when technology is deployed in the medical or operational area? I would say neither. I would say in the patient area, in the homes of patients, wherever they are, by them being the point of care, I expect the most breakthroughs coming for those purposes. Of course, there will be great breakthroughs in medical technology, which can only be used by medical professionals. But I expect most technologies to come out about technologies used by patients primarily. Philip Nemeti, what do you think about the new tests for coronavirus in Austria recently introduced? If you mean the free testing, the chance to test for free anytime they want, then of course it's great, even though vaccinations solve a pandemic, not free tests. But if there is something specific you have in mind, please elaborate, because then it means that I'm not aware of any technological developments in that area. Until then, let me share with you a few other questions I received through the Eventbrite website. It's hard to choose from. There are so many good ones. Okay, here is this about the at-home lab test revolution. What new remote monitoring and diagnostic testing is being developed for telemedicine? Is there a way to do remote blood tests? I think most tests that are being deployed these days to support telemedical care are mostly about food allergies, food tests, maybe some simpler blood-based tests, but you can't see anything like what Theranos, the scam company, tried to offer a few years ago. But is there a way to do remote blood labs? I have done many tests myself remotely based on a droplet of blood. That's possible. When you need a bigger amount of blood, that I'm afraid remote is not an option for now. And the Theranos scam made it really worse and harder for investors to invest into this field. So I guess this field will be lagging behind a little bit because of the damage Theranos did to this area. Akhil, what do you think about building a digital health construct for patients? I'm not sure about that, but please elaborate on what that might mean. Okay, here's a question from Team Alexander. What do you think is the future of primary care? Specifically, what are the threats to doctors continuing to provide primary care, and how can they turn these into opportunities? I think the biggest change that awaits primary care is that it's not going to be primary care anymore. I think primary care will be about a technological line, a chatbot-based service using artificial intelligence, providing a triaging service for patients. And when it declares that this patient should meet a medical professional in person, that then would come the real line of primary care. I think lifestyle medicine is the most exciting area here. For that purpose, that lifestyle medicine came to life a few years ago, I would now go to becoming a primary care physician, going through medical school again. That's how excited I am about the possibility that I can use technologies and data in a way to improve the lives of my patients, just like how primary care physicians do, but in a more efficient, more dynamic way with technologies. Hamed, Salimi, how can we take advantage of AI in differential diagnosis of diseases? I think it has been used like that. The IBM Watson has tried to do something like that, to scan through studies and textbooks to find out what kind of things doctors might have missed when making the initial diagnosis. So the algorithm didn't try to give them the right answer. It tried to find if the doctors might have made a mistake in the decision-making process. I think it sounds like something that wants to dive into their lives and jobs, but I think it can be very helpful for those doctors supporting what they have been doing. Pratibha Patel has a very strange question or point here. Trends to me equals worry, makes me feel I know so little, I'm not doing the right thing. Well, if that's the case, that's why I'm here. That's why we do the job that we do at the Medical Futurist. And we try to be helpful to you, to make sure that you only read those trends that are relevant to you, that are helpful to you, that will support your decision-making process. Pablo, of course, thank you for being here so far. Adam Schmidt, can you imagine that the lack of psychologists and psychiatrists could result in first-line mental health support through apps with avatars? I think many companies have been doing that. There are these virtual nursing companies and even for triaging patients. But maybe the most exciting one was a buzz that I saw at the NHS in the UK, that when patients have to wait for an appointment with a psychiatrist, they receive a chatbot for free and they can discuss their issues with the chatbot. That's not the same as discussing those things with a medical professional, but while they are waiting, it's sort of a relief that they can talk to someone. Plus, by the time they get the appointment, the chatbot would be able to provide a report about the major symptoms and all these issues that patients have come up with during the process. Michael Haymadi, let me share the question with the others too. What do you think the impact the Apple Watch having a blood glucose, blood pressure, alcohol measurement pulse will be? I think it would be great to be able to measure interesting and useful health parameters and vital signs. I'm not sure if technologically that would be possible with the Apple Watch. For blood glucose, they can only extrapolate. It's better than nothing, but I haven't seen it yet. For blood pressure, I'm looking at my shelf on the right. That is the Omron's Health Watch. That is a blood pressure smartwatch. It's too big to handle. I don't think it's possible to live with that, measuring blood pressure many times a day. I have an alcohol breathalyzer myself. I don't see how it could be implemented technologically into the Apple Watch. Heart rate is already there and ECG is already there. I think we would win more by not adding more and more, hardware features into the Apple Watch, but by helping medical professionals better understand the data they get from patients when they bring their Apple Watches to the medical visits. I guess that's the next step for the foreseeable future. Alan Waffy, how to empower patients, I hate that word, in general to leverage digital change, to shift care from the 20th century to hospitals to the home situation, how to influence the medicosaurus facts. I love that term. I don't think we have to empower patients. I think patients are being empowered by themselves because patients are the most motivated stakeholders of healthcare. They have a disease to manage, they have a health to preserve. So of course they want to reach out to use technologies, and I don't see how we have to empower them to do so. And there will be many patients who won't want to be empowered at all, not in 30 years from now, and they should have the right to keep on living the lives they have been living so far. But for governments, it might make sense to say out loud that we have to empower patients, like what Denmark did last year in the policy report. They want to empower patients. I think that's a beautiful sentence and an approach from a healthcare government to support the empowering process, but we don't primarily have to empower them. They are getting empowered by themselves pretty heavily. Okay, we have a few more minutes here for a few questions. Here is one from Finn Whitaker. How to help clinicians be more receptive to new technologies and stop the stethoscope situation repeating. Of course, the stethoscope situation being that the French physician Laennec came up with the first gadget idea, and physicians didn't want to accept that for 30 years. Now it's accepted, but 3 decades, and it was just a hollow wooden tube, not even a digital stethoscope. So I think with proper education, if we prepare them for the technologies they have to work with, if we help them better understand how these technologies can support what they do, then they won't have fears. They won't overhype technologies. They won't reject others just because they fear it. And I know that it worked because that's how I've been teaching medical students for more than 10 years. And that's the kind of feedback I get from them years after they graduated, then they started practicing medicine, that they knew how to handle those technologies. And it makes my heart warmer that this approach works in action. A few more things I wanted to share with you without leaving. First of all, we have a very new article about your new life in 2021. We try to summarize the life we are all living mid-post COVID-19. What kind of things will definitely change, and some things we know for sure now, some things that are very close to becoming sure, and some things we will not know for sure for still a long time. But there are some rules we shared, so please feel free to check it out. We have published an article about the ideal hospital. We are quite excited about that because the weeks before we had been writing about many aspects of the hospital from the future. This is about the ideal hospital of today and what kind of features it should have. And we also published a very weird article about what would we do in healthcare with $1 trillion in our pocket. How we would, what kind of things we would change right now that are free, what kind of things we would change that might cost a bit but not much, and what kind of things we would change that would cost a huge amount of money but would be worth doing so. So please feel free to check those out. In the meantime, I check out if we have any final questions. How do you see the field of synthetic biology and its implication on the medical science? It would be great to see synthetic biology being used more against climate change, because those are the results I've seen being the most exciting, at least for me. Maybe in medicine, the role I can see for synthetic biology is by producing medications in a different way than how the pharma supply chain usually does that. Oh, Philip, thank you for describing that. I didn't know, I haven't seen that test before, so I can't give you a proper answer here, but I will look into that because a mouthwash test sounds intriguing. So I will look into that later after the Q&A live. One more thing here before I don't forget it. Please, again, Check out our newest infographic we just released a few minutes before the live Q&A about what we want to achieve with vaccinations, why we all have to get vaccinated. I also received mine. I hope if you have a chance, please live with that and get your vaccination. And we have, if you go to the, I'm sure that Judith Kusko, our editor-in-chief, can share the link again to the article we have about the top 20 digital health trends of the near future. Then you can see the first 20 pages for free. You can decide for yourself if you want to buy it. Of course, if you buy it, it means you support what we do at the Medical Futurist, because we don't advertise. We don't sell advertising spaces. We never accept sponsorship for device reviews we do, for example. So we try to be objective for you, but we can only do that if you keep on supporting us. If you support us, we can create even more articles, we can publish even more analysis, we can record even more videos and gadget reviews. And if you don't know us, you can go to medicalfuturist.com, and we are quite active on Facebook, Twitter, LinkedIn, YouTube, and Instagram. We publish analysis about digital health and AI news every day. We try to provide the context. I do it myself personally for you. And also, if you want to support us in another way and still receive exciting content, then you can go to our Patreon channel, patreon.com/themedicalfuturist, where you can find all the articles we publish for our patrons. Here are the posts. We have, first of all, the patrons we have, they can get the ebooks for free. That's a feat of being a patron. You can see amazing analysis that we don't publish anywhere else. You can see infographics and podcast firsthand before anyone else on our channels. Plus, again, if you are there with us, if you become our patron, you support us so we can do what we do, provide context around digital health for free for everyone worldwide. We have about 800,000 followers for now. We are shooting for 1 million. Actually, on YouTube, we are very close to having 50,000 subscribers, and we are so grateful for that. We hope that if you haven't subscribed already, please subscribe to our YouTube channel. We publish long episodes about major topics like AI's role in healthcare, at-home lab tests, technologies in the future of sex, and exciting topics like that. We also publish future bits, shorter segments about recent news and exciting topics of the past few weeks. Plus, we publish live Q&As. All these recordings will be there for free. So please subscribe to the Medical Futurist YouTube channel, and we will publish and release the next topics, the next live Q&As. I will keep on doing these. And I cannot really emphasize how much I appreciate you being with me for the last hour or so, asking these amazing, insightful questions. You make my job really simple. And I enjoy being with you here. Again, thank you so much for watching the Medical Futurist live Q&A session. I'm Dr. Bertalan Meskó. I was your Medical Futurist, and I hope to see you again in the next session in about 1.5 to 2 weeks as usual. So thank you for being here, and have a great day. Bye.